you just never know what COVID's going to do to someone, once you get that sick. Some of it is my fault, I will admit, because I didn't get my vaccination. So we work with people who live with disability and the older population. So as soon as COVID hit in 2020, we were doing everything we could to make sure that all of our people were okay, that they had food, they had PPE that they needed, that they had cleaning supplies to keep their homes clean and sanitary so they didn't get sick. My husband is vaccinated and he's got COPD. He caught COVID the same time I did, but he had a very mild case because he was vaccinated. So I understand. My reason wasn't political or anything like that. We had so much going on here. I just couldn't take a chance on being out of the office for any length of time. But then I was out for almost 6 months. So flawed thinking, though. The only thing I can say is I should have gotten a shot. So I thought, well, I made it to January 2022. I dodged a bullet. I just got up with a weird cough and tested myself and tested positive right away. I was using an oximeter and it said my oxygen levels were good, but I had on 4 coats of nail polish. I wasn't reading anything. When I actually got to the ER, my oxygen levels were just above 80%. So they admitted me right away. And I didn't feel like I was really struggling with breathing or anything. I just felt really bad. It wasn't a bad cough. It wasn't anything really horrible to me at that time, but they came in and told me they couldn't keep my oxygen levels up. So about 11:30 or 12, they notified me they were going to put me on the ventilator. I got COVID pneumonia. My lungs were full. And I just didn't know you could get that sick without feeling that sick. When I left ICU and went to a regular hospital room, I couldn't even lift my arms up. I couldn't do this with my fingers. I had to relearn everything from scratch. And I couldn't feed myself. I couldn't even hold a cup of water. So someone had to be with me all the time. I used to have hair down to here, past my shoulders. I lost so much of it that I just went ahead and got it cut off because I would get handfuls of hair this big when I brush my hair out in the morning. I can taste and smell, but things that are sweet make me sick. Things that are salty, it's really easy for them to be way too salty. I do have brain fog, but I just can't think of what the word is. I mean, and there are things that I know, but they just don't come to me. And I forget things, so I write everything down. I went through this for a reason and to share my experiences. If it's going to help someone else make a better decision, then that's fine with me. I'm an open book. But, I think more people need to do that so that there's a better understanding.
Great, thank you, and welcome to our webinar. The end of the public health emergency is approaching. What is next for COVID-19? We're very glad that you are joining us today. And I wanted to, my name is Matt Norris from the Center for Health Equity at the Indiana Institute on Disability and Community. I wanted to take an opportunity to let you know about some of the accommodations we have available. We do, as you can see, have an American Sign Language interpreter. Thank you for joining us today from DeafLink at the League in Indiana. And we also have captioning available. You can, whatever device you're using, you can find the captioning on your device app, whether it's Zoom on your computer, Zoom on your phone, find the caption. And we do have a captioner today who will be with us for the duration. You can also visit the stream text link if you would prefer to have some variability in the way that you view the captioning. We'll provide that link in our chat window, so feel free to use that as well, and that allows you a little bit more modification for you if you choose to use that. And I would also like to remind everyone today, we are recording this, so just wanted to let you know that this will be available later on our website. So if you find out some things that you want to share today, feel free to visit our website. We'll be providing that link later in our webinar. That will be available, our website, and where this webinar will be archived. And then finally, we will have some questions and answers today. We're very thankful that Dr. Lindsay Weaver from the Indiana Department of Health is joining us today, and she will be doing a Q&A. We received a lot of questions, and we'll try to get to as many as we can. And if we have some that come up during the presentation, we'll try to get to those as well. But first of all, I would like to lead off here with introducing Dr. Jae-Chul Lee here at the Center for Health Equity, who will be giving us a kind of an update on what the Institute is doing with our COVID-19 project.
Thank you, Matt. Hello, everyone. I'm Jae-Chul Lee, a director of the Center for Health Equity at Indiana Institute on Disability and Community at Indiana University, Bloomington. Once again, thank you for attending our first webinar in 2023. As some of you may know, our center and IIDC had 3 projects on COVID-19 for the past couple of years. We're pleased to tell you that we received additional funding from the Center for Disease Control and Prevention, CDC, through the Association of University Centers on Disabilities at AUCD. But we continue to serve as a regional hub for the Federal Emergency Management Agency, FEMA, Region 5, including Minnesota, Wisconsin, Illinois, Indiana, Ohio, and Michigan. We will promote vaccine outreach within the disability community and try to increase vaccination among people with disabilities across the lifespan and their family and paid caregivers in the FEMA Region 5. So as you may have noticed, our focus has expanded a little bit this time. Previously, we focused exclusively on COVID-19 vaccination, but this time we addressed vaccination in general, such as, for instance, COVID-19, flu, measles, and shingles. But we continue to focus on information dissemination. If you're not familiar with our previous COVID-19 work, please visit our project web pages. We have created variety of resources, such as kind of fact sheets, infographics, social stories, vaccination videos, and webinars. And most of them are available in English and Spanish and American Sign Language. Now, regarding our webinar, these days, a lot of people, the public in general, do not worry about COVID-19. COVID-19 and the boosters are not on their to-do list. This may result in confusion and concerns among many people with disabilities who often have multiple chronic conditions and also are immunocompromised. People with disabilities and their caregivers are wondering about the current status of COVID-19 and our next steps. Given this, our webinar addresses a timely topic, having Dr. Weaver, Chief Medical Officer for Indiana Department of Health, and also 2 disability advocates will share their experiences and thoughts during the pandemic. Now, I'd like to have one moment for one announcement. If you live in Indiana and care for individuals, minors or others with disabilities, please note that we here at IIDC currently conducting a brief online survey. We all know COVID-19, the pandemic, has affected our mental health. So that we can better understand this issue, we are currently conducting a brief survey on mental health for caregivers of people with disabilities here in Indiana. Don will share a link to the survey through the chat. If you are family caregivers of Hoosiers with disabilities, we really appreciate your participation. This survey will end this Sunday, probably March 19th. If possible, please fill it out today, and you can feel free to share the survey link with your friends. Once again, family caregivers of Hoosiers with disabilities. So once again, we really appreciate your participation. Matt, I will turn it over to you.
Thank you, Jay Chul. And thank you for mentioning our website. We had a question from one of our attendees about where they can find the link to that great video that opened up our webinar today. And that was Chris from Indiana. She's a disability advocate here in our state. And that video is on our website, and you can go to vaccination video stories and find that link. And that's kind of a good segue into our next part of our webinar. And I'm going to introduce my colleague, Peggy Holtz, who will be joining us along with a couple of other disability advocates from Wisconsin and Minnesota. So I'll turn it over to you, Peggy.
Thank you, Matt. And I would like to have Deborah and Dolores go ahead and unmute and start their cameras. And I want to thank them for joining us today. Dolores is joining us from Wisconsin, and Deborah's joining us from Minnesota. So I'd like to just start off with having you talk a little bit about how the pandemic has affected your life and why it was important to stay up to date on vaccines. And Deborah, do you want to start?
Sure. You know, the biggest impacts, I don't drive. So one of the biggest impacts, especially at the beginning, was figuring out how to get everything. I was used to grocery delivery and those types of things, but those things changed dramatically with everyone else trying to get grocery delivery. And I was lucky enough to actually be visiting my mother. I went 3 days before the shutdown and stayed 6 weeks. So it kind of was a better experience. And you know, why I've continued with the vaccines is, one, I have a mother who's in her 80s and I want to go visit her and keep her safe and healthy. And I think, to me, vaccination is about protecting yourself, but more importantly, it's about protecting the people around you that you care and love and, you know, really care about and love. And even people maybe you don't even like that much, but you still should protect people from getting it. And it's, you know, it's quick, it's painless. And I've had, the only side effect you really have is you don't feel very good sometimes the next day for a couple hours. It's nothing major. So.
Did you want to talk a little bit about, you had mentioned you're high risk and.
I am overweight and I do have high blood pressure. So therefore I'm a little higher risk. And I did, you know, I did have issues at the beginning getting on that list. I had to actually call my doctor. So, you know, it goes into, we have to advocate for ourselves. I had to call my doctor and request to be placed on the list properly because I wasn't getting tagged in the system before that. So I just think it's very important to, you know, if I was really taking care of my health, I wouldn't be overweight, but nonetheless, like I said, it's about protecting yourself and the people around you. And the biggest challenge I think I had was the fear that if I got COVID, since I don't drive, who am I exposing to COVID to get there? On that potential. And now we have home tests, that's not an issue, but at the beginning it certainly was. So I think the disability community kind of got just forgotten because there were so many other concerns that they kind of forgot about what does this mean to the disability community.
Thank you, Deborah. Dolores, would you like to?
Okay. The pandemic affected me because I had a son and a mother who lived in the house with me, both with underlying conditions. And I fired all the caregivers for safety reasons, because you never know where a person's going, where they're coming from, or who they came through before they got to you. So I taught myself that while my mother and my son were sleeping, that I had to do early shopping trips, because I need to get in the store when they open and get out before the crowd gets there. My son was hospitalized, and being hospitalized for 31 days, they did not let me see my son. There was a time when I could see him, but the second trip, they would not let me see him. And it really damaged me and my son, because without the communication to my child who could not hear and could not speak, did not have communication in the hospital. So he got very depressed. And he even came home a tube feeder because they said he couldn't swallow, he couldn't chew. Which I knew better than that, but you know, it is what it is. I sent pictures out there. He got to see me duo on Zooms every now and then, but that's not like seeing me when he wanted to see me. But you know, I got real lucky. I got my vaccinations, and my son, my mother too, but Hyatt Pharmacy teamed up with me to help me through this. I started vaccinating people because people with disabilities were just stuck at home and nobody thought that they need to get their shots. So I did it myself. I had shots where they were drive-through shots. I did block shots where we went on the block and gave out soul food dinners to anybody that wanted a shot. And if they just wanted to just eat, first they had to roll up their sleeve. I had a few words with them, but you know, they got the shot. So that's all that mattered. And it was just a experience that I hope I never have to endeavor again, because I did lose my son in 2021, but it was not COVID. It was his underlying seizure disorder that caused his heart to quit, and he died. But I did, out of all of this, I did get very, very good recognition. I was invited to the White House, where I was, out of all these VIPs there, it was like I was the one. I was the person that they did the press release on, due to the fact I was helping all of these people with disabilities in block shots, going to the house, going to Hyatt Pharmacy. And when I started with the kids had disabilities, but I talked to their pastors of their churches, and we made it happen where I could take them into Hyatt Pharmacy and get the shots, and then go across the street to go to Corral and get a meal. So everybody was ready for that. It was just an experience that I experienced, and now that it worked out all right, I love the experience because I helped a lot of people that, in other words, wouldn't have got help that they really needed.
That's great. I mean, that was amazing work. And I remember one thing that you said, you were walking in your purpose.
Well, yeah, after my son died, a lot of people thought, because I own a business parent university, and a lot of people thought I was going to close it because it is a resource center for people with disabilities of all ages. And when I was in DC, they asked me about that, and I told them, well, I guess COVID came along. My son died, COVID was here. And so that kept me walking in my purpose of helping people. Because for 35 years, I was a worker for a group home. And I was helping people then, and everybody in my family that gets sick or what have you go down, I was always the caregiver. And right now today, I'm still the caregiver.
Could you briefly talk about, and Deborah had mentioned how the pandemic has affected people with disabilities. Could you briefly talk about, you helped some kids with autism during the pandemic?
Oh yeah. You know, a lot of kids with autism, they live on a schedule. They go to school, and you know, every morning everything is the same. But I had 3 students that was not accepting this pandemic, and it was just killing the parents because the parents was off work, kids was at home. These kids were used to getting up, taking a bath, showering, having breakfast, put their clothes on, and sit in the window waiting for the bus. Well, the bus didn't come, so that caused a lot of problems, because that's when the kids having episodes where they want to strike out and just can't figure out why them. So parents call me because they know that I have a 24-hour system. Call me anytime you need me. And they told me they didn't know what they was gonna do. The students was tearing up the houses. I mean, just being aggressive was just terrible. So what I did, although our office was closed, those 3 students I had come to my center every day to the office, and they set an 8-foot-long table so they could be apart, and brought their Chromebooks to get their schoolwork done, because they just felt that they needed to go to school. And it was so funny. They learned a lot. They were not behind in school and everything. As a matter of fact, when I talked with the teachers, it was like these kids did the best. Everything was done. Nothing was lacking. And, it was just, I was glad that I could help them. And the parents, they were able to live a fruitful life because they got their time away so they could make plans for these kids' dinner and what they're going to do to reschedule them because they couldn't do afternoon activities or anything. So also, I forgot to tell you, I sent out gift cards to students so that if they did go to the store, they could buy snacks and have a movie night at home with their families.
Well,
So
that's
that was
great.
like the activities that I did.
That's great. I'm going to go back to Deborah and talk a little bit about, the webinar is about the health emergency expiring. And if you could talk about, what your thoughts about that are and concerns. And I also know that you had mentioned, how the pandemic affected people. Maybe talk a little bit about the difficulties people have with getting tested or.
Well, sure. At the beginning, in particular, when we didn't have any home tests at all, the biggest challenge was how am I as a disabled person going to get to a testing center? And are the testing centers accessible? If I have a wheelchair, can I get into them? And then, once the tests became at-home tests, for a lot of disabilities, they were not accessible. Anyone with low vision, even, let alone no vision, certainly couldn't have used them. Anyone with some cognitive issues or potentially with some dexterity and mobility disabilities certainly couldn't have used those tests. So I think that was a big concern. I think there's a lot we can learn from that and figure out how to do it better if, heaven forbid, we ever go through this type of thing again. And on the other side of things, as far as this ending, where my concerns start to lie with this ending is there are some healthcare providers that are going to continue to pay for testing and treatment. There are some who may not. I think that fewer and fewer people will go in and get tested. Fewer people will have tests at home if they're not free. So I think we have a slight risk of a resurgence as that ends. And in addition, let's look at the effects that aren't about just having COVID, but are about the impact to individuals and what happened to them financially, what happened to them mentally with being isolated, with maybe potentially losing their jobs. We already in Minnesota have a pretty hardy crisis with food shelves and food needs. And surprisingly, because Minnesota is actually a fairly affluent state for the most part. And my concerns are that's going to increase a great deal as these extra benefits end. And I just worry that people are going to end up neglecting themselves because they have to, because they just cannot afford to go in and get tested and pay for the treatments. Hopefully most healthcare providers will opt to, at least for the next 6 months to a year, if not longer, to continue to pay for those. And I know Medicare is planning to. I don't know about standard healthcare. I'm self-insured. So some of the self-insureds are probably about the worst as far as taking care of you there. So I think that's kind of where everything's falling for me. I just worry that I don't want to get back into a resurgence, and our economy cannot currently handle another lockdown. I don't think we'll survive. The long-term effects of businesses is still continuing. I've seen many long-term restaurants in particular in Minnesota that are now still shutting down. So
thank you, Jerry. You have a lot of ideas. We're starting to get short on time, so I want to give Dolores an opportunity to talk about her thoughts about the health emergency expiring and what plans she has.
Well, it isn't gonna expire, but I think I would call myself lucky. I received a grant to keep vaccinating. But it's not just for COVID, it's for flu, pneumonia, shingles, whatever vaccinations people needed. And I'm still gonna do soul food dinners. Come and eat, roll up your sleeve. Let's keep this so I can kind of keep the people boosted, have their boosters and all their shots in them. Because although we have to see what happens if when they do stop the emergency do expire, but at least if I could just be positive, keep my people positive, I think we'll see a better world. We still getting our shots, we still having our conversations. They still can come to my office, and when they come to my office, we can talk and they can live, laugh, and learn, because it's something that we can't control. But what we can control is our own life. So in our own life, we'll just keep getting our shots and keep moving forward and making the best out of life that we can.
All right. I think, that was a great place to end. I want to thank both of you. Both have so much information to share, and, you've had some real experiences during the pandemic. So again, I want to thank you for joining us today and sharing your thoughts and experiences. So Matt, I'm going to turn it over to you.
Thank you.
Thank you, Peggy, Dolores, and Deborah. And I would like to introduce now, we're going to go right into welcoming Dr. Lindsay Weaver, who this is not her first time joining us. So we appreciate her coming back and joining us today and kind of giving us an update where we're at with the pandemic, and from there kind of, what's next for it. And I'll let Dr. Weaver come on and join us. I was remembering, I think you joined the Indiana Department of Health right when this pandemic was starting, but I'll let you do your own introduction, and we'll go ahead and get started with your presentation.
Yes. Hi, everybody. It is good to see you again, and thank you for inviting me back to speak to you. So I am the Chief Medical Officer here at the Department of Health. And yes, I started in February of 2020. So I joke with people that I have just learned what my job with the Department of Health really is just here in the last 9 months, and was primarily 100% COVID for the first 2 years. I do consider it one of the greatest blessings in my life to be in a position to be able to do something to help people during this time. So, yep, here today to talk to you all about, where we at with the public health emergency ending with COVID. And I'll just say that we are definitely in a time of transition. So unfortunately, you will hear me say many times that we will have to see, that there's lots of discussions going on, but I will give you an update with at least what we know now. So just give me 1 second and I will share my screen. All right, I think I did it. Okay, so it is the end of the COVID-19 public health emergency and is planning on ending on May 11th. So we heard from the Department of Health and Human Services that they are planning for the emergency to expire on May 11th, and stated the reasoning behind that is that daily COVID-19 reported cases are down by 92%, deaths have declined by over 80%, and hospitalizations are now down nearly 80%. I would say in addition to that, we are now in a better place with knowing how to treat COVID. We have the available tools to treat it as well. Our hospitals have the equipment needed, the PPE, et cetera. So a lot of things have been able to be put into place over the last several years for us to better combat this disease. So there are many things that will not be affected on May 11th, and there are some things that will be. So I am going to go through these because I think some of these will matter to different people, and I want to make sure to take the time to share it. So your access to COVID-19 vaccines and treatments such as Paxlovid and Varia, sorry, I never pronounced it wrong, will generally not be affected right now. So right now, those are still, the vaccines are provided for free, and that will still be what it is for the time being. And they are working to think about what that will look like as it transitions into the regular healthcare marketplace later in this year. So more to come there. The emergency use authorizations for the test, vaccines, and treatments will not be affected. They were able to accelerate the process of review, emergency use authorizations, et cetera, through the public health emergency. But all of those that are still in place will continue to stay there. The telehealth flexibility. So there was a boom in the use of telehealth in healthcare, which, we were kind of right at that point where we had the opportunity to move better into this space, healthcare providers talking to their patients, which I feel, many of you probably have experienced that benefit. I know I did throughout the pandemic as well, to be able to, talk to someone by phone or by video. So those will not be affected. I think we saw that there's definitely a use for that. And those will continue at least through 2024 as they continue to figure out what that looks like as far as payment and rules and regulations in the future. Same with Medicaid. Medicaid telehealth flexibilities will not be affected. And like I said, they are developing plans to ensure a smooth transition from the vaccines and current COVID-19 vaccines and treatments to include it into the traditional healthcare marketplace. So what will be affected by the end of the public health emergency? Certain Medicare and Medicaid waivers and broad flexibilities for healthcare providers are no longer necessary and will end. I will talk to you a little bit more specifically about Medicaid as that process of redetermination is starting in April. Medicare beneficiaries who are enrolled in Part B will continue to have testing coverage without cost sharing as long as the test is ordered by a provider. But their current access to free over-the-counter COVID-19 tests will end. So no longer able to get it over the counter for free. Can get it free if you have a prescription from your provider. Additionally, they're going to update and change the requirements for reporting of lab results and immunization to the CDC. So what does that mean? That means that the current COVID-19 dashboards, both on the national level and here in Indiana at the state level, will change, and they will look different because of what will actually be reported. For example, likely will not be reporting all tests, and so then we would not be able to calculate the percent positivity, because you need to know negative tests and positive tests. So more to come with that. Certain FDA COVID-19 related guidance documents that affect clinical practice and supply chains will end. The ability to detect early shortages of critical care devices related to COVID-19 will be more limited because hospitals will no longer be required to report inventory. And the ability of healthcare providers to safely dispense controlled substances via telemedicine without an in-person interaction is affected. But they are still looking at rulemaking that may extend those flexibilities. Also, the PrEP Act, if you ever heard about that, the most important thing from our standpoint on the public health side with the PrEP Act is it was able to extend the number of people able to give COVID vaccines. So, for example, our EMS providers were able to give vaccines. So that liability protection will be impacted, and so it would then limit. Unfortunately, we're not in a position where we need mass amounts of vaccinators anymore, and have largely gone back to our traditional vaccinators. But that includes the pharmacists as well. So as I mentioned, I did want to specifically call out Medicaid. We had a waiver where people did not have to do their redeterminations for the past several years. So that means there's about 500,000, so 500,000 Hoosiers that will be affected by the public health emergency stopping and those waivers ending. And so we need 500,000 people in Indiana to respond. We do know that there are many people who will lose coverage, but they are of course eligible to get insurance coverage through the marketplace, like the Healthy Indiana Plan, Hoosier HealthWise, Hoosier Care Connect, or maybe even traditional Medicaid. And many will be able to stay on traditional Medicaid as long as they give that updated information. So really, really important if you are on Medicaid. Encourage you to go to FFSA benefits.in.gov, go to manage your benefits, and then sign into your account or create account. You can also call 800-403-0864. Really important. This is going to be going on over the entire year, but if you call now and get it taken care of, then you will be in a better place. And so, as I mentioned, the change in Medicaid, so that Medicaid will never discontinue, and this is not just Indiana, this is going to be nationwide, a member's coverage without first letting them know. And so people will be receiving information in the mail that they need to respond to. But like I said, members may no longer be eligible for coverage through the Medicaid program and should check if they qualify for coverage through the federal marketplace online at healthcare.gov. So if you no longer qualify for Medicaid, do encourage people to go to healthcare.gov for the federal marketplace. And if you're over 65, look into healthcare coverage through the federal Medicare program. So on to COVID-19 updates. I did pull these just this morning. So the map on the left is our community level. So for the most part, we're green across the state of Indiana. And the one on the right is level of transmission. So how much COVID is moving about within a community. And you can see that we do have some red counties there on that map. This is our most updated coronavirus.in.gov map that shows all of our trends. So that top green wavy line is our hospital admissions. And you can see that since early last year, we have maintained much lower COVID hospitalizations, but clearly people are still getting hospitalized. That teal is emergency department visits, so people presenting with COVID. The red is deaths, the yellow is cases, and that purple is wastewater. So something I do like to point out to people, and the next slide I'll share with you our wastewater dashboard, is that our wastewater actually has been a better indicator of the level of transmission in our community than the tests. So as a couple of the earlier speakers talked about at-home tests, because of the prevalence of at-home tests and really people just not getting tested, we're not getting as many of those test results in, but we are able to test for the level of COVID in the wastewater. And so that purple line down there, you can see better correlates with the level of our emergency department visits and our hospitalizations since like, again, looking back into like the spring of last year. So we do utilize this to communicate with our providers that, hey, we're starting to see an increase of COVID in the wastewater. And of course, that is your sewage. When you go to the bathroom, they check the sewage at the water plants. And let them know that, hey, cases are going up. And so be prepared for hospitalizations to start to go up as well. We still have a significant shortage of nursing staff in our hospital. So any forewarning that they get that they need to step up and be prepared to take care of more patients is they really appreciate. Here is our wastewater dashboard. We have testing sites all over the state. If you saw the national map, you would see that we're pretty well represented in Indiana. We have lots of sites. That's credit to the team here at the Department of Health, really promoting and looking to add more additional sites. And as I mentioned, we'll continue to use this to monitor for the level, even if people are no longer reporting testing to us. We'll still be able to communicate that to people, kind of what's going on with COVID in our community. And then hospitalizations as well, just to draw attention to, yes, we have recently seen, in the last month or so, we saw an increase, but we were actually back on the downtrend for hospitalizations. Predominantly still remains that XBB.1.5, which is the Omicron, one of the Omicron variants, is still the most prevalent in our community and across the country. So some vaccine updates, lots going on in this space. The CDC and the Immunizations Committee have been meeting pretty regularly to talk about what is the future of COVID vaccines. I am specifically addressing, I'll quickly go through those the vaccine schedule for people who are immunocompromised. But then when I'm done, I'll show you there's actually a calculator on the CDC website, and I have the link there for you. If you're like, I'm not sure where I'm at, what I need, you'll be able to put in, your age, what you got for your primary series, how long ago was that? Are you immunocompromised or no? And it'll let you know, do you still need a booster? Do you not, et cetera. So again, this is for people who are immunocompromised. So children 6 to 17 months, 6 to 17 years. So just looking at 6 months to 4 years, there is no bivalent booster there. So if you are immunocompromised, there is 3 doses, 5 to 11. They would get the updated booster, Pfizer booster, as a 4th dose. So they get their primary series, which is 1 and 2, because they're immunocompromised. The recommendation is to get that 3rd dose at least 4 weeks after that 2nd primary series, and then to get the updated booster at least 2 months afterwards. In all cases, that updated bivalent booster is meant to be 2 months after your last dose. 12 to 17 is the same, your 3 doses because you're immunocompromised, and then the updated booster 2 months after. So looking at Moderna, you can get the updated booster here for 6 months to 5 years, and also 6 to 11. So the same thing, you have your 3, so your 2 original primary series, and then your immunocompromised dose, and then the 4th updated booster. And then the same for adults. For Pfizer, your 3 doses, and then your updated booster. And that can be Moderna or Pfizer in these cases. And then also 18 plus, it's the same. So 3 doses, and then your updated booster, and that is Moderna or Pfizer. Some people have received the Novavax vaccine, of course, for Johnson & Johnson, so those look a little bit different. Novavax, you get your primary series, and then 3 weeks, so that's first dose and 3 weeks later, and then 2 months later, you can get an updated booster. If you receive the Johnson & Johnson, they did recommend you to get an additional dose at least 4 weeks afterwards, and then the updated booster. So here's that link I talked about. If you're like, wow, this is way overwhelming and too confusing, I do encourage you to go here or talk to your clinician about, what are the best next steps for you. As I mentioned, the CDC and ACIP, which is the Advisory Committee on Immunization Practices, are continuing to meet to talk about what the future looks like. So they're talking about looking at the vaccine data and the current efforts in the COVID-19 vaccines to say, looking at, again, always reviewing safety, risk-benefit assessment, and anticipated vaccine updates later this year. Still say, COVID-19 vaccines are the most effective tool we have to prevent serious illness, hospitalizations, and death from COVID. The goal of the vaccine program is prevention of severe disease. The benefits of additional COVID-19 boosters does vary by age, the time since your last dose, the time since you've last been affected by COVID. And they do recognize that that the plan is to move to a more simplified and likely annual recommendation that could reduce vaccine and message fatigue. So be looking for that. They haven't come out for sure, but everything they've been talking about so far is saying that they'll be looking to probably do a recommendation every fall, winter, similar to influenza, for a yearly COVID-19 vaccine. Again, goal is to keep it simple after these super complicated series that we have right now, and they'll take all the information that they have and review and come forward with those recommendations. Just again, a graph, I think it's always helpful to see this. That green line on top there is is people who are unvaccinated, and this is hospitalization. So the green line is hospitalizations, and then that blue line are people who have received vaccines, including the booster dose there towards the end. And you can see that no matter what, if you just got a primary series, if you got 3 shots, if you got your updated booster, much reduced compared to those who are unvaccinated. So I always tell people, it's not too late. Stories like the one that Chris shared at the very beginning are so powerful. Her experience is actually not uncommon. We see people that come in that really their oxygen level is so low that they're confused, that they don't even know how sick they are. So we actually saw that quite a bit, that people are like, I don't feel bad, I feel fine. And their families like, they're not acting themselves. And the reason they're not conscious of how unwell they are is because their oxygen counts are just so low, which was the case of Chris. They've also updated the general vaccine schedule. So I did want to provide this here. Again, make sure that you're talking to your clinicians to make sure that you're up to date with all of your vaccines. We had a really big early flu season this year, saw a lot of flu hospitalizations and deaths, unfortunately. So again, every year, make sure you're getting your annual flu vaccine, make sure you're getting your pneumonia vaccines. People in general are behind. Kids and adults alike are behind in their vaccine schedules. So make sure that you're talking to your clinicians to make sure that you're up to date and protected. We've seen a lot of viruses that kind of were tampered down by COVID have had a resurgence, including RSV this year. And so recommendations for even RSV vaccines will be forthcoming. Just a couple of things to note, that Pfizer is seeking an emergency use authorization for an updated Omicron targeted booster for the 6 months to 4 years. Like I talked about, we have Moderna, but not the Pfizer. And then Novavax says it may not continue its vaccine initiative. So just some updates. Also to know that Paxlovid, so this is the antiviral medications that you do not have to have a positive test anymore to receive these. If you have the symptoms, your clinician can write without having that confirmed positive test. Also, this is really for immunocompromised people. So EvoShield was a medication that we are giving to immunocompromised people to help protect them from COVID-19 disease, but unfortunately, it does not work against the Omicron variants, and so it is no longer being recommended. And again, make sure that you are doing everything you can to protect yourself, especially when there is an increase in COVID in the community. Get your vaccine, improve your ventilation, and spend time outdoors. Know where you can get tested and access to medications. Get tested if you've been exposed or have symptoms. Wash your hands frequently. And then, of course, if you're immunocompromised, recommendation is to wear a well-fitting mask if you are in a not well-ventilated, so an indoor space with lots of people. Again, even with these new variants, continued vaccine effectiveness is being monitored, and we're still seeing people be protected by the vaccines. Someone had brought up a question about Mpox, so formerly known as monkeypox, now being called Mpox. What's going on with that? We don't have any no recent Mpox cases here in Indiana. However, we have been notified by the CDC to be prepared that Pride season is coming up, and they do want to make sure that we're continuing to test, that we're still promoting vaccines, but currently there is no Mpox in the community. They are testing wastewater for that as well. So I think that this is the future of us being able to detect diseases here in Indiana and across the country. And again, you can see Indiana there has lots of sites that are testing, and all the blue means no detection. Just a quick update on the Governor's Public Health Commission. We are talking to our legislators right now to increase public health funding so we can do all the things to help people across Indiana with health and their health care, preventative, and specifically thinking about those that have limited access to resources or are all the people who kind of fall through the cracks. And that is what public health is there for, is we are the safety net to make sure that everybody gets access to what they need. So if you definitely encourage you, if you're so inclined, to call your legislators and let them know that you support public health and that you support increased funding so that all of our local health departments across the state who know what's best is going on in the community can put in funding and efforts to help. I do want to quickly go through some of these questions here that people have put forward, and thank you so much to all of you who put forward questions. They were really amazing questions. So I think I pretty much already answered this. I got the booster in September. Am I still protected? So again, protection against severe COVID-19 lasts longer than the absolute risk against any type of COVID. So they have done studies, and they're saying that people continue to have higher protection against infection. It's significantly for hospitalizations, significantly higher against death many months out after vaccine. If I had COVID, why do I still need to get the booster? I hear that having COVID gives me some immunity. So yes, if you've had COVID, you do have protection from that, and you can still benefit from getting the booster. But your timing of the booster could be dependent on clinical factors. So you have, limited protection from your infection. So people are timing out their booster to get at a later time so they can have even longer protection from that. So if you recently had COVID, still need to stay up to date with your vaccines, but you may consider delaying your next vaccine dose by 3 months from when you had symptoms or when you had a positive test. Reinfection is less likely in the weeks to months after infection. However, if you are an immunocompromised person or you're living with someone who's immunocompromised, that definitely again would be a conversation I would have with your clinician to say, well, I probably do have some protection here, but to what extent? And it's kind of a risk-benefit discussion there. So the bivalent booster protects against certain variants of COVID, but those variants are no longer the dominant variants. Should I still get the booster? So yes, it still offers protection. Like I said, they are looking at new updated vaccines that are specific to Omicron, and then we'll see what their recommendations are for the fall. So just quickly, so looking at specifically these Omicron variants, the results showed that a bivalent mRNA booster dose provided additional protection against symptomatic Omicron infections for at least the first 3 months after the vaccination in a person who had previously received 2 to 4 monovalent vaccine doses. And again, just showing this is rates of COVID-19 deaths by vaccine status, just how well it continues to work. And, there's different variants that have come along during that timeline. So a 9.8 times lower risk of dying from COVID compared to unvaccinated people, and 2.4 times lower risk of dying from COVID-19 compared to people vaccinated without the updated booster. Can I use expired at-home tests? No, there are certain chemicals in there that can break down and make them no longer useful and could give inaccurate results. So please throw those away. How accurate are the home tests? They still remain accurate about 80% of the time. A lot of times it is your user error. How much virus did you get on your swab? And so they do recommend serial testing. If you have the symptoms, test. If it's negative, wait 48 hours, test again. If you get a positive test, you have a positive test and then treat it as such. Many people are still worried about the possibility of getting long COVID. What have people learned so far? So this is where I told you I'm going to say a lot is we're still learning. So this is a new disease process. It takes time to gather the information around this. So research is ongoing. They do think that there's evidence that suggests there may be important differences in how long COVID manifests itself in different racial and ethnic groups. So that is another component of it that they're studying. Looking at large sectors of people and just starting to study it. They do show that women were an increased risk compared to men. Older age above 30 years was also associated with a higher risk of reporting long COVID symptoms. And then what about treatment? Treatment right now is symptomatic. So just treating you for whatever symptoms that you have, whether it be shortness of breath or pain or numbness or tingling, all of those things, and research is ongoing. Do we have a way of tracking people with long COVID? There are national groups that are collecting this information. It is difficult for us to collect on the state side because it's not a test, right? It would take a doctor's diagnosis. And we know that often people are unreporting or underreporting their symptoms. So among those who have ever had long COVID, over half are no longer reporting symptoms. And among people who have had COVID, 11% are currently experiencing long COVID, but an additional 17% had long COVID in the past. We've actually seen a reduction in the number of people who have said they have long COVID, so seem to be getting better. And that is it for my presentation.
Great, and you got most of the questions as well, but we had a couple that come in. Let me go ahead and see if you have a quick response. Here's a question. As a disabled Latina, I don't feel safe going indoors when masks aren't mandated. Dr. Lindsay Weaver, what are you specifically doing to help disabled people feel safe to go indoors since transmission levels are so high?
Yeah, so, again, it is up to the individual facility, place, location to decide what their masking requirements are. So it is definitely up to those individual places. I will say that you are getting protection from wearing the mask yourself. I think also considering, like, let's just say like a grocery store, there are definitely times when the grocery stores are busier than others. And so just trying to time your time to be there where there's maybe not as crowded, but I know that's not always possible either. But I think, making sure that you're trying to take your space, wear your mask, make sure that you're doing your good hand hygiene and you're washing to do everything you can protect yourself. And of course, the vaccines are available for additional protection as well.
Sure. And this kind of is a related question. I'm a mom of an immunocompromised toddler. How do I keep him safe when the emergency ends, when we need to go to the hospital where masks aren't mandated?
Yeah, so even at this point, masks are not mandated in hospitals, in clinics, and I think we're going to see more hospitals and clinics to end their masking requirements. To that end, especially with immunocompromised patients and even any patient, I think it is 100% appropriate to ask that your clinician wear a mask. We wear masks, always have for immunocompromised patients when we're seeing them. And so I think this is not abnormal. Probably we didn't do as good a job at it in the past. But I think given everything we've learned over the last couple of years, 100% and completely appropriate. And if you feel like you're not getting the response you need, especially at a hospital, most hospitals have patient advocates. So always know that that is a tool in your toolbox to say, I would like to speak to a patient advocate if you feel like they're not being responsive to your request.
Great. And a lot of the information you provided today, it's great information for people living in Indiana. We may have some folks, I know we had our panelists from Wisconsin and Minnesota. I'm guessing that they could probably go to, like the Minnesota State Department of Health and find some comparable information in terms of whether, Medicaid specific to that state or
Yes,
specific to
yes.
what programs the state's running. Probably the
Yep.
best place to go is the Department of Health.
So for Medicaid, I would just say if you're in Minnesota Medicaid, and go from there. They should all be providing a phone number. Every state also has 211. So that may be your easiest thing is to call 211 and say,
Right.
I have Medicaid. I'm worried about losing my Medicaid coverage. Who do I talk to? And they should connect you. If that would be the easiest way, or you can, search Medicaid in the state that you're in. No surprise here. Every state does it a little bit differently. So I do not have the details on those other states, other than I know that they're all going through the same process right now. And us on the public health side and healthcare side are worried, right? We know we want our patients to have coverage that they can seek the care when they want to and not have to worry about that. So please, and if you are a patient advocate, if you work with people who are disabled or any sector of patients, please make sure that you are communicating those out to people as well. And then even assisting them. So we have put a charge here at the Department of Health that every single one of our divisions is doing outreach to their community-based organizations, their stakeholders, people that they care for specifically, and making sure that we're making it part of what we do, even though technically us as the Department of Health are not in charge of this. It's actually our Medicaid part, which is a whole other agency here in Indiana. I will just say in some states, Medicaid and the Department of Health are together. That's just not the case here in Indiana.
Great, thank you. And we're going to end our webinar here. Thank you, Dr. Weaver. Thank you for our panelists from Minnesota, Wisconsin, and the disability advocate from Indiana who did that great video interview with the staff here at the Center for Health Equity at the Indiana Institute on Disability and Community. And we would just like to thank you for joining us today. As we end this webinar, you will be taken to a survey that we hope you will take a minute or so of your time to fill it out and complete it. We'll go ahead and we've shared the link to our website. Feel free to visit our website and check out the other videos that we have. You can also follow us. There'll be a link there to our social media. The Center for Health Equity at the Indiana Institute on Disability and Community. We are working with as Jay Chuli mentioned earlier in our webinar, we are working with a regional advisory committee from representatives from different states. So we'll be sharing information, not just specifically about Indiana, but also with those other states as well. So thanks again for joining us today, and we will be ending our webinar right now. Thank you.